Well, good afternoon. What a joy it is to see all of you here today. It's my pleasure to welcome you to our annual meeting. I'm Mike Tavlin, and I have the honor of serving as the chairman of the Endowment's Board of Trustees. On behalf of my fellow trustees and our staff, we're delighted that you have joined us here today. I'd like to introduce my co-trustees. It has been a pleasure to work alongside of them for the past year, and for many years in some cases. Kimberly Russell, who's our vice chair, Doug Gans, our secretary, Britt Miller, treasurer, over here, Tom Beckius, Carol Burt, Charlene Gondring, is Judy Hallstatt here? I didn't see Judy walk in. There's Judy. How could I have missed?
Yeah, sorry.
Lauren Mestre-Roberts, Dr. Michael Mulvar, Kim Moore, and Dr. Charles Wilson. Trustees unable to be here today are Georgia Blobaum, Rick Poore, and Tina Udell. Thank you very much. And I'll now introduce the endowment staff. Lori Seibel, our president and CEO, Stephanie Eels, our project manager, and Jody Lose, our office manager. And before we go on in the official program, I want to note for all benefit of all here that after 7 years of absolutely fabulous work on behalf of the endowment, tomorrow is Stephanie's last day with the endowment. And Lori, I think you had something that you wanted to say here? Come on up.
This is a surprise. I love surprises.
I don't like surprises.
Steph has been a wonderful program manager for us. When she came, there was a lot of things, just like when I started this position, I wasn't really sure what I was getting myself into, but it ultimately fit like a glove. And the materials that you have in front of you are the work primarily of Steph. The things you see up here are the work of Steph, our Facebook, all the things that are reaching out to the community. And we're just really grateful for the many contributions she made to CHE and to the community. And so, surprise here. Here is a beautiful framed Burke holder that represents the skyline of Lincoln that we would like to give her with gratitude.
Prepared for this, but I will say that it has been a wonderful 7 years working on behalf of the community, working with all the wonderful trustees we've had over the past few years, people like Mike. What's great is I'm not leaving our community. I will actually be here at Bryan, so still in the world of healthcare and still contributing to our community as best I can. So thank you. This means a lot.
Thank you, Stephanie. I recalled a quote attributed to Dr. Martin Luther King Jr. as I thought about our meeting here today. It's the one featured on the cover of our annual report. Life's most persistent and urgent question is this: what are you doing for others? The endowment is able to do for others by virtue of its relationship with agencies and individuals in our community. Agencies and individuals in this room today, working to make a positive difference in the health of others. It is through their and your good works that the endowment is able to advance the cause of good health in Lincoln. That is why being here today with all of you is such a special honor. It's because of what you are doing for others. Recognizing individuals who give of their time and talents to our local nonprofit agencies and contribute to the overall health of our community is very important to the endowment. We provide recognition each year with our annual Horizon and Closing the Gap Awards, our partnership with the Lincoln Journal-Star on Making a Difference ads, and our promotion of projects and grantees. We hope you've taken a moment to view the screen over here and see some of the past Horizon and Closing the Gap Award recipients and Making a Difference and honorees who are volunteering their time and talents to our community. On behalf of the endowment and the community, we thank you for truly making a difference in helping us to realize our vision of making Lincoln the healthiest community in the nation. Kim Russell, Vice Chair of the Board of Trustees and President and CEO of Bryan Health, would like to say a few words of welcome on behalf of Bryan Health.
Mike, thank you very much. On behalf of Bryan Health, we'd like to welcome you all here today. We're so very pleased and proud of our involvement with Community Health Endowment. And I think it's particularly fitting that we're meeting here today given the origin of the endowment, which of course was when the city of Lincoln took the proceeds from the sale of Lincoln General Hospital, now known as Bryan West, and formed the endowment. And we're so very pleased and proud to see the CHE board continue to help us all as a community fulfill the mission of Lincoln General. And you can see that when you see the outstanding causes that CHE has provided grants to over the past years. So on behalf of all of my colleagues at Bryan Health, welcome. And it's now my honor to present the Horizon Award today. We've made a slight change in the agenda, so we're going to go ahead and do the award at this point. And I'd like to present the award to Captain Joseph Wright with the Lincoln Police Department. Congratulations.
Thank you.
I'll ask you to stand next to me while you hear all these wonderful things about yourself.
Great.
Well, first of all, just so the audience is aware, the Horizon Award was originally created to recognize the contributions of people in our community that work to help CHE fulfill its mission of making Lincoln a healthier and better place to live. The CHE board certainly knows and recognizes that our best attribute is the people who live here. Many residents enrich the community by sharing their time, talent, and treasure. And so we have the opportunity of identifying and recognizing just one of those individuals every year. And this will be the 13th year that we've given this honor. So a bit about Captain Wright. He is a 25-year veteran of the Lincoln Police Department. And with this very lengthy tenure, he has, I'm sure, many stories and many tales of encounters that have involved behavioral health issues. He has given time, attention, and priority to these behavioral health issues by making education, awareness, and sensitivity a priority for both his fellow officers and for the public. And if you see the enclosure on your table, you can see how deeply he has been involved in educating really the whole public, how much he has devoted his professional career to this very specific aspect of police work. We are extremely grateful for his time and dedication. We know our community is a better place because he is here and a leader among us. So Captain Wright, thank you so much for your service to the community and many, many more years to come. Thank you.
Thank you very much. I think many of you are familiar with my public speaking. I do quite a bit on the Channel 8 and Channel 11 where you see me for 10 seconds with a camera 3 inches from my face and I'm telling you why two cars just ran into each other. Just since the doors are closed, a little secret, I really don't know why they ran into each other. I just know that they did. So in all seriousness, an award like this really recognizes the cooperation between people, the effort that unconventional partnerships can produce, the synergy that's created by people trying something new, not afraid to be different, and working together. So when you can, when you see someone who's experiencing behavioral health issues and know what they're dealing with, if you realize that a lot of people are pushing a rock up a mountain, if they need a break, if you can step in and hold that rock for them for a little bit while they get some respite and catch their breath, they're fully capable of continuing with their hard journey, and they're very appreciative of your help. So thank you very much.
Good afternoon, I'm Doug Gans, and it's my honor and privilege to introduce this year's recipient of the 2013 Closing the Gap Award to Dr. Maria Prendes-Lintel. The Closing the Gap Award was created to recognize the important work being done by individuals and groups who demonstrate courage and persistence to eliminate barriers in healthcare access and to reduce health disparities. Today marks the 8th year that this honor will be bestowed upon a person or a program working to reduce inequalities in healthcare, what Dr. Martin Luther King called the greatest form of injustice. The Community Health Endowment is very pleased to recognize Dr. Prendes-Lintel for her work with immigrants, refugees, and survivors of torture, and for improving mental health services in our community. I've also been honored to serve with Dr. Prendes-Lintel on the CHE Board of Trustees. During her tenure on the Board of Trustees, she challenged us to recognize the important connection between physical and mental health, and she never failed to remind us the challenges faced by immigrants and refugees as part of their healthcare experience. On the table, again, you'll see some information related to her many accomplishments. On behalf of the CHE and the entire community, we want to extend a big thank you to Dr. Maria for her service and for making Lincoln a healthier community. Thank you, Dr. Maria Prendes-Lintel. Thank you.
Thank you. Well, certainly thank you for this honor. It's not very often you get awarded for pursuing your passion. So thank you again. I'm very excited about what's happening in Lincoln right now. There was a time when we knew in the treatment of the immigrants, the refugees, the torture survivors, that we had to treat in a biopsychosocial spiritual model. We had wonderful cohorts like Francisca Peterson, who worked with me from the beginning to develop, to train physicians, therapists, community, case managers, our patients, and interpreters, so that we could all provide services, because we knew that we could not do it alone. Even though we thought we were pretty good, we could not do it alone. That person coming in that had traumatic brain injury and numerous atrocities done could not just be treated by behavioral health, that I needed to work with Madonna, who was amazing, or the community physicians who really helped us to make this person again thrive. So I'm excited. I'm excited in those 6 years that I served with the Community Health Endowment. I learned where I once thought that we had a pretty big mountain to climb was not so big anymore, and that's really exciting. There are trustees that were as compassionate and passionate in closing the gap, in assuring services. So I'm excited as Lincoln moves to integrate behavioral health and primary care. And I am just sure that with the way we're going, we're certainly going to make Lincoln the healthiest community. Thank you.
Good afternoon. I guess it's my turn. My name is Brett Miller. I'm the chairman and treasurer, and chairman of the investment committee. Lori, I have not seen this before arriving here today. Your letter, your executive letter, you start out with much more than money. It's all about the money. I try to take a little different approach than most people here. And she asks, what is the size of the fund? I hope you know. What is your average rate of return? I will tell you. How many dollars did you grant? And once again, you should know. Welcome to the annual stockholders meeting portion of the afternoon. And I will apply the corporate philosophy to the shareholder meetings in the modern world. I will be brief. To begin, I would be very much amiss if I did not personally thank the members of the investment committee for the hours they put in during the year and the unique talents they bring to the endowment. So thank you very much, Mike Tavlin, Doug Gans, Tom Beckius, Carol Burt, Kim Moore, and Tina Udell. You all make a difference, and we thank you. Now for the numbers. The first charge of the Endowment Committee is to protect the original inflation-adjusted principle of the endowment as created. The original $37 million adjusted for inflation now stands at $54,200,000. Despite difficult economic conditions worldwide, the financial health of the endowment remains strong. For the 12-month period ending April 30th, 2013, the endowment fund grew by 10.2%, ending with a balance just north of $60 million. And I'm especially pleased to look back in time a little bit. As of June 30th, 2008, you may remember back then, the fund balance was $48,750,000, now $60 million. Also during that 5-year stretch, the endowment awarded grants totaling $8,700,000 that was distributed to the community. Finally, the board remains diligent in assuring that the fund grows at or above the rate of inflation for future generations. We will keep administrative costs low. We will return as much as possible and prudent to the community. And it is my pleasure to announce that for the 3rd straight year, the CHE Board of Trustees has approved the largest grant budget in its history. We will be returning $2.2 million to the Lincoln community in 2014. And that concludes my portion. I'd like to turn the podium over to Lori, who will introduce our keynote speaker. Thank you.
Thank you so much, Britt. And I do know it is all about the money. I always take just a minute, if you would allow me, for a point of personal privilege to say thank you to a few people that have meant a great deal to the endowment, and those are our retiring trustees. They are not retiring because we've asked them to, but because they must, according to city ordinance, after 6 years of service to the Community Health Endowment. 2 of them at 6 years, 1 of them at 3 years. So I want to recognize today 3 folks, Charlene Gondring, Mike Tavlin, and Rick Poore. Rick Poore is unable to join us today. He's served for 3 years, and it's been a pleasure to have him on the board. Charlene Gondring, if you'd stand for just a minute so people can see you. Charlene has served actually more than 6 years. She has served 8 years. She filled an unexpired term and then served an additional 2 3-year terms. She has served as chair of our funding committee, which is really one of the toughest jobs on the planet, but she did it with grace and with thought and with fairness, and we're just very grateful for what you've given back to this community, Charlene. And if you would help me thank her, I would appreciate it. I also want to thank Mike Tavlin. Mike goes back even further than that. Mike goes back to when CHE was simply an idea and serving on the mayor's task force that determined what to do with the proceeds of the sale of Lincoln General. He then served a 6-year term. He took a 2-year hiatus, of which we were in contact with him constantly. And then he returned for another 6-year term. So it is 15 years of service to the Community Health Endowment, of which we cannot be any more grateful than we are right now. So Mike, if you would take a moment to allow us to express our appreciation to you. Absolutely one of the best parts of my job is learning to know leaders in this community and people who care passionately about the health care of this community and the health status. I've had the pleasure of serving alongside a number of people, and today I'm just so grateful to have a number of our former board presidents with us. And if you all would stand and turn and say hello to the crowd, I would greatly appreciate it. Bill Lester, Ed Wimes, Christy Chavez, Mike Alicio, Janet Coleman, Michelle Peterson. Who am I leaving out? Anyone? Thank you for being here. I do want to tell you that at your table are a couple of items. Please take a moment if you'd like to look through our annual report. And also there is a piece called Community Conversations on your table. This is a series that we will have this fall related to health equity. We would love to have you join us for those conversations. They'll be fairly small and intimate, but I think you'll find them to be very enjoyable. And there's information there on how you can sign up for those so that we know how many cookies to buy. And so if you would do us the pleasure of joining us for those particular conversations, one or all of them, we would be glad to have you. So now it's my pleasure to introduce you to Dr. Jay Parkinson. When we begin looking for annual speakers each year, we try to find folks who will make us think. And obviously there's a lot of people who can do that, but I mean really think. People who are kind of ahead of their time, people who are thinking a little bit differently than maybe the standard run-of-the-mill folks that we might work alongside every day. Somebody who's kind of stretched themselves just a little bit farther. And we think that today's speaker fits that bill. After all, he has been called the doctor of the future. He's been called one of the top 10 most creative people in healthcare. And he's the kind of person that will take us on a little bit of a journey about what the future may hold for all of us. I came across Dr. Parkinson when we both were speaking at a conference at the Mayo Clinic. And it was a conference that was intended to bring together folks who had new and creative ideas about how to do things in the healthcare system. And his talk was primarily about how to transform this traditional patient-doctor relationship. But as I got to thinking about it, I really believe that it was applicable to more than that. Many of you in this room deal with clients every day, and I think it will make you think a little bit differently about how we're all beginning to have to communicate and think differently about the health processes that we use. I think it's fair to say that we are in an interesting time in our history in healthcare. What my parents or my grandparents expected from our healthcare system is not what my children or my grandchildren will expect. They simply see the world differently because of rapid transformation and advancements in technology and the way that we communicate with each other. So you may not see today, when you leave, you may not see the world the same way that Dr. Parkinson does, and you may or may not agree with the system of care that he's creating. But I can guarantee you that what he says today will make you think. And it will make you think about how you and your organization can prepare for the future. So please give a warm Lincoln welcome to Dr. Jay Parkinson.
Hello, everyone. Is the mic working? Everything's working, right? Okay, excellent. Thank you so much for having me. It's a real honor to be here. So just want to ask a question. How many of you own a cell phone? Maybe, how many of you don't own a cell phone? Yeah. It's interesting, huh? How many of you guys have a Facebook profile? How many of you don't have a Facebook profile? A few, huh? How many of you think Facebook's annoying? Yeah, I actually do too. I'm not a big proponent of it, but it is interesting that it serves some sort of utility in our culture. I mean, it's easy to keep track of family and friends. Now, I do a lot of speaking to med students, and I ask one question, which I'm not going to ask here. Who's the youngest one here? Now, the medical students will say, somebody will raise their hand and say, I was born in 1991. Which is, you know, pretty amazing, right? Because when was Amazon founded? You know, not too many years after that. The world's changing, and it's changing pretty quickly. So my entire sort of professional career has been devoted to figuring out what this means for healthcare and our culture, and how patients expect to, you know, interact with their physicians. That's what I do. I was trained as a pediatrician. These are my godchildren. I then went down to Hopkins to do a preventive medicine residency, and worked with a few interesting people down there. I worked with Ralph Nader, his public health interest group there. I worked with Peter Provenost. He's a gentleman that created something called the surgical checklist to ensure that doctors are, amputating the left leg rather than the right leg, or vice versa. So he's the one that taught me that everything is a process, and you have to design the process. And if it's not designed, it'll kind of design itself. And I feel like that's a good explanation of what happened in healthcare. There's really not a huge emphasis on the patient experience. And I think there needs to be. There are some institutions that are doing a great job at that. But I think everyone can do better. So once I was done with Johns Hopkins, I moved back to New York City because that's where my heart is. I really love New York City. I did my first residency in pediatrics there. And, I was I'm a bit of a photographer, so I had a lot of art friends. They were the creative, people in New York. And I was their doctor friend. So, a lot of them don't have insurance, so they would send me, an email with this picture of this rash and be like, "Doc, am I dying?" And I'd have to be like, well, maybe tomorrow you might die, but no, I would then help them just sort of figure out what this is. And it happened so much that I was just like, my goodness, I could probably start my own practice doing just that. So in fact, that's what I did. I designed my own website, told the world, who I was, my philosophy, my story. And if you liked it, you could just click that big button in the middle that said make an appointment. And that would bring up my Google Calendar. You could tell me your symptoms, your address. You'd probably snap a picture of that rash. You would give me your address, so then my iPhone would alert me that I had a new house call to make. So I would do a house call. Most of my patients were uninsured. They'd pay me via PayPal, and we'd follow up on Skype. So my overhead for this practice was about 10% compared to a traditional doctor's office, which is about 75%. It cost about $1,500 to start. And I got 7 million hits on my site in the first month. Because it was a great story. It was a young doctor in Brooklyn making house calls. It was sort of like Marcus Welby powered by the internet, So people really enjoyed that. So it was all over the news. And that led to something called Hello Health. I kept practicing, but I thought, I got so much interest from other doctors who are also interested in doing something like this that, I figured maybe if I build a platform that powers this type of practice, maybe with or without the house calls, maybe it's just an office-based practice, but some platform that allows doctors and patients to communicate, and doctors to get paid as well, because we can't work for free, and just document, communicate with labs, order, prescriptions, that sort of thing. So that's what I built. It was called Hello Health. It's a platform that's very much inspired by Facebook and Flickr, the things that we use nowadays on a daily basis. So this is sort of like, this is the main page of my practice. My patients are making appointments with me. They are commenting on their last visit. We're meeting in the office about 80% of the time. The other time, we are communicating via just messaging, just like we do on Facebook nowadays. And I could just see what's going on in my practice. And the other interesting thing I could do is I could just see all the profiles of all the people in my practice. I could see their history. And I could also add them to groups. So for example, if I have 50 asthmatics in my practice, and I ran across some really interesting article in the New York Times about asthma, I could just send that link to all of my asthmatics in my practice. And I always call it sort of like information therapy. It's something that I can came across on the internet, and I think everybody should benefit from in my practice. So I would send them a link. I could also friend other doctors. So, you know, a doctor in California who's using Hello Health, I could be friends with them. I could communicate with them about my patients. They could communicate with me about their patients. It's very much just an open forum. Patients have profiles. They fill out, they answer, you know, health questions and things like that. And they find their doctor and then schedule an appointment with them. They choose their time. They get to choose. The first visit's always in the office. The second visit is however way we see fit to communicate. That could be a video visit, which is what you see here. It could be, you know, just a message, or it could be another office visit. So in order to prove this out, this platform, to make it happen, we had to build some practices. So this is the first practice in Williamsburg, Brooklyn, which is my neighborhood, which is known as like the cool, hip neighborhood of New York. So it's, imagine a town, you know, about a quarter the size of Lincoln filled with 25-year-olds. That's packed into like 30 square blocks, you know, that's sort of my neighborhood, right? So this practice immediately resonated with them. We took over this vintage clothing store, put some work into it, and made it somewhere that people wanted to go. Something beautiful, something homey, something that looked like it was part of the neighborhood. We hired a bunch of really, really amazing doctors. And this message really resonated with the doctors. Doctors always sort of, you know, hear about us in the press, for example. And they come to us because the message sort of resonates with their desire to practice medicine in a different, better way. So we had to advertise that the practice exists. So we put up some ads in the subway. This was our first ad in the subway. We really wanted to engage with the community, see how they were feeling. And we did a pretty good job. So this is exactly what we wanted. And if you read some of these, I mean, some of them are really, you know, beautiful. Some of them are really heartbreaking. But they're kind of real. So the subway system actually made us take these down because it encouraged graffiti, which then we got into the news again because it was a censorship issue, which drove another 500,000 people to our site. So it's sort of making the media work for you. You guys, I'm sure you figured it out a little bit, huh? So anyway, this is what we did, and then we finally replaced it with this. And to the patient, their experience is often the old school experience. It's just this messy system that's more of an industry than a system. So we wanted to replace that with something that's very, you know, linear, very simple, and less confusing for them. So I like to think of the world in a different way. You know, you guys have, you think about, like, if John has 32 candy bars, he eats 28, what does he have now? Yeah, exactly. Is that is this like a popular joke? I've never heard this joke. He has diabetes. But I also like to look at the world a little differently than everyone else, because, you know, everything is a perspective. So I like to make things that are you know, kind of, you know, hidden, a little transparent. And I like to pretty much prescribe happiness and make people as healthy as they possibly can be. I like to look at something very, very complex, which is, you guys can read that, right? And I want to make it beautiful and elegant. This is the same thing. It's just presented in a different way. So these are the kind of things that I like. And I like to do this for doctors and patients. Very much inspired by this gentleman. He's a country doctor in the late 40s. This is a Time Life series. He was in Colorado. This is a day in his life. And I just think it's really interesting because nowadays this doesn't really exist. You know, and this is what I want to take back. I want to take this personal relationship back with the patient. Because now healthcare looks like this. It doesn't look like that doctor really connecting emotionally with his patients. There are a few problems. I don't like to talk so much about problems in healthcare because, well, you know, everybody knows that they, they exist. But one of the big problems is there's just no data around what's best practice. Only about 10% of practicing as a doctor has data behind it. The rest is tradition. So it's very interesting because one day you'll read in the New York Times that eggs are horrible for you. And then the next day you'll read that they're absolutely perfect. They're healthy. That's what keeps us living long and being strong. But in reality, you have to wonder, who's paying for this study? You know, is it the egg farmers of America? Is it the vegans of America? But in reality, it's really just probably a medical student study, you know, that the media picked up on. And it's confusing us, you know? So I think this is probably one of the most eloquent summaries of where we are today in terms of medical science. If you're attracted to ideas that have a good chance of being wrong, and if you're motivated to prove them right, and if you have little wiggle room in how you assemble the evidence, you'll probably succeed in proving wrong theories right. And that's a real challenge for doctors, because the practice of medicine is a moving target. You know, we might be told that every woman should be on hormone replacement therapy, and then a couple years later find out that it's actually doing more harm than good. So the practice of medicine changes every 5 years or so, and the quality is a moving target. And it's something that's very difficult as a doctor to deal with, because our arsenal is limited. I'm going to ask a question. How many drugs do you think the FDA approved last year? Okay, don't be shy. Got to throw out a number. Come on. 50. 50? 27. 1,000? So that's interesting. A lot of people actually say around 1,000 or 500, and I think that says a lot about pharmaceutical marketing. In reality, there were 9 new molecular drugs that were approved by the FDA last year. The other, let's see, I think there were 16. The other 16 were basically just marketing gimmicks, like Claritin is going off patent. It changes to Clarinex, and they get to sell it as a new drug. So our arsenal is actually getting kind of limited. The pharmaceutical industry isn't really saving us. So I also think the exam room is ineffective. Whenever you think about your year, there are 8,766 hours in a year, and you spend about 1 hour with a doctor. And
it's after you wait for an hour to see.
that's exactly true. That's exactly true. So to me, that's very interesting, because the exam room, the concept of the exam room is a little broken. It's sort of like whenever you, we've all been to those family reunions, right? Where you haven't seen anybody for like 20 years, and you have to have this sort of uncomfortable conversation about, hey, how's the last 20 years of your life been, man? And it's just weird, you know. But in reality, what I think is really wonderful, and one of the things that I think is wonderful about Facebook is that, you know, my parents, my dad, you know, my mom, my brother, they all live in St. Louis, is where I'm from. I live in New York City. But, you know, my dad is posting on Facebook a couple times a day his thoughts and what he's doing. And it allows me to connect with him. It allows me to see what's going on and be a daily part of his life. And I think that's really interesting. And I think that doctors have that opportunity to have that type of relationship with their patients. And when you think about doctors and what we do, we try to diagnose things and treat things, right? But the way we diagnose, 90% of a good diagnosis is taking a good history. It's just communication, just asking the right questions. So think about what you do whenever you go to the doctor's office in the exam room. It's about, this is what it, you know, back and forth. But in reality, you get about 18 seconds before your doctor interrupts you, right? So that's kind of interesting. Now, you're really nervous. You're kind of intimidated. You might be sick. You might be hurt. And if you could think of the worst way to communicate with someone, it would probably be that. You know, constrained by 7 minutes. Somebody's in a rush. You don't feel listened to. That's that's probably the worst way to communicate. We sometimes do a physical exam. although the physical exam is sort of fading away as we order more and more tests, blood tests, and CAT scans and MRIs and things like that. That's my friend Zach. But in reality, our specialties, I think, are a little outdated. I think we've trained in silos. I trained as a pediatrician. Someone else trained as an internist. That internist would treat my 93-year-old grandfather, and it also treats my employee, who's 25 years old. Now, it's really interesting. Once you graduate from your pediatrician, you're sitting next to a 93-year-old. He has totally different needs than my 93-year-old doctor. In fact, he has about 30 to 40% of them actually have a chronic illness. Those chronic illnesses aren't diabetes, heart disease, cancer, like we see in the elderly population, but it's anxiety and depression, injuries, work and family stress. As you guys know, it's a huge issue. Infectious disease, STDs, acne, asthma, these kind of things. So 30 to 40% of them do have these issues. And I think that it's interesting. I think that doctors should be focused on, there should be a specialty that focuses on this mid-age population because we have very unique issues. The other thing is that hospitals are just simply unsafe, right? Whenever you, sorry guys. Whenever we're sick, we go to the doctor's office and surround ourselves with sick people, It's probably the worst idea you could think of, too. There's a big waiting room. You get to go. You get to, maybe get a procedure or something like this. It's funny. This is a painting from, it says 1898 down there, and it's like we wear gloves now, So it's kind of sad though, because the evidence says that 100,000 people in America every year die from coming in contact with the American healthcare system. Medical errors, things like that. And it's interesting to me because our nation's, highways, only about 35,000 people die every year on our highways in America. So it's about 3 times as many. So what we want to do is keep people out of the system as much as possible. So the other issue is it's hard to find a good doctor. We've all been to an amazing doctor, right, that really connected with you, made a lifelong impression on you. And we've all been to those doctors that haven't. So as a patient, doctors advertise to you. If you're a New Yorker, this is Dr. Zismore. You know Dr. Zismore. When Hillary was, becoming a senator at New York, there was a quiz like, "Are you a real New Yorker?" Well, if you're a real New Yorker, you know Dr. Zismore. He's a dermatologist who advertises horribly in the subway system, right? Everybody makes fun of him, but his practice is booming, right? Now, his competition is this lovely woman here, right? Who would you choose? Dr. Zismore or this lovely lady? Well, it's interesting. There's zero data to say that Dr. Zismore is a better or worse doctor than this person. It's all about perception. And it's all about, there's some communication, there's some sort of personality. Do you jive with Dr. Zismore or Dr. Marmer? It's very difficult as a patient to figure out who you need to see and who you will connect with best. So all these issues, I'm just trying to fix this. My life is it's a lot of fun because I do get to think about what does healthcare mean? What do all these changes in our healthcare system and our culture mean for the delivery of healthcare? So I created a company called Sherpaa. We started in February of 2012. Basically, it's just a complete redesign of the process of healthcare delivery. I want to make healthcare accessible, affordable, and most importantly, by doing that, you make it appropriate. So, whenever you think about what we do from the patient perspective, I'm going to tell you a story. This is a guy. He sent us a message. He was describing classic appendicitis. So, we forwarded this email on to our general surgeon, who's located in Union Square, just a few blocks away from this guy's home. Dr. Goldstein is our surgeon. Dr. Goldstein said, send him right over. So we sent him over. Dr. Goldstein examined him, thought it was appendicitis, had a CAT scan done, sent him over to his outpatient surgical center, and the CAT scan showed it was positive for appendicitis. So they set him up a room. He took out this gentleman's appendix laparoscopically, and 3 hours later sent him home on oral antibiotics. So within the span of 6 hours, he'd contacted us and was home minus an appendix. And I think that's really interesting because the current procedure is, well, my belly hurts, I should go to the ER. It hurts pretty bad. You know, you might be next to a couple of heart attacks. You might be in New York, you're probably next to a gunshot. You know, it can be kind of rough and expensive. But in reality, we can design a process that costs $60,000 less, which is exactly what this costs, $60,000 less, and takes 6 hours instead of, hours and hours and hours of confusion in the emergency room. So our patients at Sherpaa, they have a portal. They create a profile. They answer about 50 health questions, so we know who they are as physicians. And then they log in whenever they're having an issue. They say, it's urgent, speak with the doctor now. That calls our doctors immediately. Or I have a question that can wait a bit. Whenever they choose, I have a question that can wait a bit. They say, I'm sick, I'm hurt. They have these options. And what's interesting about this is there's a big text box here. Sorry. There's a big text box here. And what this means is, instead of that 7-minute visit where you're nervous and intimidated, you actually have a lot of time to sit down and read, or sit down and think about what you want to write. So you've probably been Googling your symptoms. You're afraid of something. So these are the things that we encourage. So right now we're getting a few paragraphs of information from patients. Our doctors get that information, fire back a few more questions, and it turns into a very interesting conversation that we have over time with our patients to figure out exactly what's going on. We're gathering a really wonderful history where people get to think on both ends. They don't have to think on their feet. They can take a little time to figure this out. So I think it's a great way to communicate. This is their profile. Some of you guys get the joke, but yeah, anyway. But just traditional healthcare, I think, is very, different. It takes about, 24 days to get in to see a primary care doctor in New York City. Only about 10% of our healthcare system in New York City is primary care. So it's very difficult for our people to, get in to see anyone. So with us, we're 24/7 email and phone access to a group of doctors in New York City. So without Sherpaa, you might see the doctor 3 times a year or something like that and spend a few minutes. And it's sort of like that old school family reunion, remember? Like it's hard to catch up, right, with your patients. But with Sherpaa, it's more of a, an ongoing conversation that you have with your patients about health, and it happens online. So for patients, you save time, money, just like the guy with appendicitis. I think you have better, closer relationships with your patients, and you have an insider directing your every move to a wonderful experience. So from the doctor perspective, what we do is we hire doctors and we salary them. And their full-time job is to sit by the computer and the phone to answer questions from our clients. So we just hire experienced, empathic communicators that are evidence-based and mission-driven. They're the doctors that we've all been to, and they've made a significant impression on us because they have wonderful personalities. So we're just trying to make them extremely accessible because I think accessibility is the best prevention. And we want them to be in a pleasant, safe environment. We don't want them to be surrounded by sick people. We want them to be, somewhere that you can reach out to in a safe way. So our doctors get paid for communication. They can work from anywhere. And the focus is on communication and creatively solving problems. So we have a group of about, we have 3 doctors now that are answering phone calls and emails. And we have a group of about 100 doctors who are specialists in New York City that we refer to. whenever we can't solve the problem over phone or email. These doctors, they're also mission driven. They're very, they're very tech savvy. We can text them, we can email them. We can say, hey, Dr. Sun, you're a neurologist. We need you to see our client today. He's having a new onset of headaches. So we have to give our doctors technology, and this is what our platform looks like. It's really just like a Facebook messaging type system. But we can see all of our clients. So when people come ask a question, their entire history is available to us, and their health history is available to us. So, So what's to me really interesting is there's some wonderful resources out in your community, in New York City's community. But the problem is people don't really know how to leverage the best resources. So we just give somebody they can contact. Give them someone they can contact 24/7, and we help them decide, do you need to go to the ER? Do you need to go to the urgent care center? Do you need to see a primary care doctor, maybe a specialist? Or do you need to just hold tight and just, we'll reassure you, you're doing fine, no problem, So that's really what we do. We help people decide next steps, but we also diagnose and treat. What's fascinating about this is 70% of things that come to us stop at us. Right? So it's a woman that has every year she gets a urinary tract infection, something like that. We can get a history, and we can simply prescribe and call in that medication to the pharmacy around the corner from her, and she can go pick it up. So that means 70% decrease in claims, which to me is very interesting because this now takes us to the business model of what we're doing. We're redesigning healthcare and the healthcare delivery process. So how do we get paid for that? Most doctors get paid for office visits and procedures, but we're communicating with people without office visits or procedures. So how do we get paid? Well, our clients are companies. Tumblr, for example, is one of our clients. It's one of the top 10 sites on the internet. We have about 40 companies now that have signed up with us. Right now, it costs companies about $14,000 a year per employee for health insurance in New York City. And that doubles every 7.5 years. So by the end of the decade, that's going to be nearly $30,000 a year for health insurance. So what I think is going to happen is that high deductible plans are soon going to be the only affordable option. It's typically about $2,000 deductible for each individual. Now what that means is the employees are then responsible for their first $2,000 before health insurance really kicks in. Now the healthcare system is not set up to spend cash, right? So we encourage every employer to give each employee a $2,000 debit card that they can spend on healthcare expenses. So knowing that at the end of the year, only about 15% of that entire pool will actually be spent, and the rest of the money goes back into the company tax-free. So what we're doing is instead of you blindly going to the ER and spending that $2,000 in that one ER visit, we're giving you a doctor on call 24/7 to figure out exactly what you need to do. And remember, 70% of the time, all that stuff stops at us. And we solve that problem right then and there. So Tumblr is one of our main clients. The year prior to Sherpaa, they had 80 ER visits. The year after Sherpaa, we sent 2 people to the ER, right? So this is a perfect example of how we can save money for companies. In Tumblr, for example, 75% of the questions coming at us were medical questions. I'm sick, I'm hurt, something like that. The other 25% were actually health insurance questions. So like, hey, I just got this bill for $6,000 from this ER visit last month. What does that mean? What is this? So they'll upload a picture of the bill. We'll look at it. We'll call up the ER, call up the insurance company, figure out what's going on, see that it was a medical billing error, and instead of them owing $6,000, you owe $100, right? So 25% of our questions coming at us are those questions. So I think we're going to soon open that up to the rest of the United States. so that people can upload bills and we can help them figure out exactly what to do and help them save money and clear up this confusion. So 90% of Tumblr use us every year. Premium increases went up 6.3% this year. The insurance company told us if they would not have had Sherpaa, it would have gone up 13%. So we halved the premium increase. And that's a pretty significant savings. It's about $200,000 in savings for Sherpaa, or for Tumblr. Saves about $1,000 to $4,000 per employee per year. So we're pretty excited about that. Really what we're doing, though, is gathering these forward-thinking doctors, forward-thinking patients, and forward-thinking companies, bringing them all together, because I really do think that's the future, right? And I really think that if we want to make something better as a country, we really have to create it ourselves. Businesses are the ones spending $14,000 per year per employee. I think we should be buying something better rather than sustaining the same old system. So I think we can make healthcare better and awesome together. So thank you very much.
Thank you, Dr. Parkinson. That was phenomenal. Way to go. We have one additional change to our agenda this afternoon. I've known Mike Tavlin for many years. More one of you might agree. Mike will always say, in business or personal life, I don't like surprises. So we won't call this a surprise. We'll just call this a little addition to the agenda. Lori?
Mike, can you join us up here? I told you a little bit about Mike earlier today and his absolute conviction and commitment to our organization and the time that he has spent 15 years with our organization. I have to tell you that during that time he was instrumental in creating this organization from an idea. He has been instrumental in passing a constitutional amendment that allows us to invest our funds differently, which has brought millions more to this community. He has remained active as a contributor even when he wasn't on the board. And without question, he has always been accessible, he's always been supportive, he's always given back in a way that I think would make any of you wish that he was on your board as well. So Mike's tenure on the board will end this August, and I think it is only fitting that his service and legacy should receive special recognition, and so we're going to do that today with the Michael J. Tavlin Award for Board Leadership. This award will become an annual tradition at our annual meeting. Nonprofit staff will be asked to nominate a board member that they believe has shown exceptional leadership, and they will be recognized at this meeting along with a stipend of $1,000 that will go to the agency of their choice for the purpose of board development and training. So it is my absolute delight, even though Mike told me, I think his first words to me were, I don't like surprises. And so I know I failed on that point today, but it is with gratitude and affection that I present the first annual Mike J. Tavlin Board Leadership Award to Mike J. Tavlin.
Thank you very much. I've often said it's an honor to be a member of the board of the Community Health Endowment. This is certainly an honor, and I appreciate it very much. Thank you, Lori. And you're right, I don't like surprises. Any surprises. Congratulations to the other award winners, and thank you, Dr. Parkinson, for your thought-provoking message. You've pushed us to think differently about the future of healthcare. I recently read the following entry on Dr. Parkinson's blog jayparkinsonmd.com. Quote, "This is what I love about what I do. My goal in life is to help doctors to be better doctors and patients to be better patients. Technology is just one of the means to do this. I'd be a fool to see a small amount of patients in an exam room for the rest of my life, when I can build a team who can design and build tools that make us all better and healthier all over the United States. It's interesting to think of how a doctor's tools progress. Heavy books and bags to apps and iPads. It's a fascinating world. And I'm so happy to be able to help hundreds of thousands of doctors in America make that transition. I'm a lucky, lucky guy, and I'm having the time of my life, unquote. I think it's fair to say after hearing Dr. Parkinson's comments today that we see his enthusiasm for thinking differently, his challenge to help others think differently, and his determination to help achieve better patient outcomes in healthier communities. Thank you for visiting Lincoln, Dr. Parkinson. You've inspired us, and we hope we've inspired you as well. I've been thinking about some of the banter that went on here before. Much more than money. It's all about the money. And I'm reminded of the saying that money's like manure. If you pile it up, it begins to stink. You got to spread it out to make it work and do good. One last word before we bring the meeting to a close. Dr. King also taught us this, quote, that change does not roll in on the wheels of inevitability, but comes through continuous struggle, and so we must straighten our backs and work, unquote. Dr. King was referring, of course, to the struggle of working for freedom from discrimination. Here we refer to the struggle of working for better health outcomes, especially for those among us at the highest risk for the poorest outcomes. And of course, we're referring to change. The Endowment's recently announced 4 funding priorities emphasize the need for change: increasing access, improving quality, preparing for change, and supporting healthy living. One point within those priorities holds special significance. It's this: building the cultural competency of organizations and providers to effectively meet the healthcare needs of people from diverse backgrounds and cultures. The U.S. Department of Health and Human Services Office of Minority Health indicates that cultural competency is one of the main ingredients in closing the disparity gap in healthcare. It's the way patients and doctors can come together and talk about health concerns without cultural differences hindering the conversation, but enhancing it. Quite simply, healthcare services that are respectful of and responsive to the health beliefs, practices, and linguistic needs of diverse patients can help bring about positive outcomes. It's up to each one of us to translate that rhetoric into reality, to match words with actions, and the struggle goes on. As we close, thank you to each person here for your attendance, your interest in the endowment, and most importantly, your contributions to the health of our community. Every community faces challenges, especially in providing health and human services to an increasingly diverse population. But Lincoln is blessed with individuals and organizations who desire to be a part of a bigger solution, and that certainly includes you in this room. The endowment is proud to be a partner with you on this journey for us to become a healthier community. Thanks very much for your attendance, and our meeting is adjourned.